is the role of a care partner of a patient who is undergoing CAR T-cell therapy?
CAR T-cell therapy is very important therapy and has evolved as a potentially curative therapy in a relapse setting. It does have, downsides. And downside, when I say, is side effects, which needs to be monitored closely, and it has to be detected early and intervene early, right? Steroids as well as tocilizumab or anti-IL-6 treatment are very, very effective in mitigating some of the side effect of CAR T. But the whole process is very involved, right? You have a patient identified, then you go through collection. Some people might get some bridging therapy, then chemotherapy, and then they get admitted. Importantly, after the infusion for 2 months, some of them could have neurological side effect. And that's why for label and for safety, the patients cannot drive for 2 months or operate heavy machinery. So the whole process requires a good support. In my opinion, when we screen a patient that, okay, somebody's referred to me or my patient going through a CAR T process, how to make sure that they have a caregiver. And caregiver is immensely important, not only for the safety, but also moral support for the patient, right? And importantly, what I make sure is that they're part of the whole discussion. When we sit down and discuss the whole process, side effects, what's going to happen, they are there. They know what their loved one is going to go through. So caregiver support is immensely important. In some patients, unfortunately, if we don't have a caregiver support, for the sake of safety, we might have to give them opportunity to see whether they can actually secure some sort of support. Maybe their, distant family member living in a different state, and if they can live with them, or their neighbor or their close friends. If they can bring them to the clinic visit so that we can also discuss with them the whole process. So caregiver is a very, very important and vital part of the whole process of CAR T.